Hey everyone, welcome back to the channel, and today we're talking about a serious topic: triple-negative breast cancer, or TNBC. Now I know hearing the word cancer can be scary, but knowledge is power. We're here to break down the signs and symptoms of TNBC that often get overlooked. Early detection is crucial for any type of breast cancer, and TNBC is no exception. It's important to remember that experiencing any of these symptoms doesn't automatically mean you have TNBC. These signs can be caused by a variety of factors, but it's always best to err on the side of caution and get checked out by a healthcare professional. So, let's dive in and empower ourselves with the information we need. Let's start with a common symptom that many women experience at some point: breast pain or tenderness. Now, this can be caused by hormonal fluctuations, certain medications, or even just wearing an ill-fitting bra. However, if you notice persistent pain or tenderness in your breast, especially if it's localized to one specific area and doesn't seem related to your menstrual cycle, it's worth getting it checked out. TNBC can sometimes cause discomfort in the breast, often described as a soreness or tenderness that feels different from your normal breast sensations. Pay attention to your body and any changes you experience. If something feels off, don't hesitate to reach out to your doctor. Our breasts are constantly changing throughout our lives due to hormonal shifts, pregnancy, and aging. However, it's important to be aware of any sudden or unusual changes that occur. If you notice a rapid increase in breast size or a change in breast shape, it's essential to bring it to your doctor's attention. Similarly, if you observe dimpling or puckering of the breast skin, similar to the texture of an orange peel, it's crucial to seek medical advice. Thickening of the breast tissue, especially if it feels different from the surrounding tissue, is another sign that should not be ignored. And lastly, any redness or warmth in the breast that persists and doesn't seem related to an infection or other obvious cause should be evaluated by a healthcare professional. Now let's talk about nipple changes. Our nipples are sensitive and can undergo various changes throughout our lives. However, certain nipple changes can be red flags that require medical attention. One concerning sign is nipple inversion, where the nipple turns inward instead of protruding outward. While some women have naturally inverted nipples, if you notice a recent inversion, it's essential to get it checked. Nipple discharge, especially if it's bloody or occurs without squeezing the nipple, is another symptom that should never be ignored. Additionally, any scaling, flaking, or itching around the nipple area, particularly if it persists despite over-the-counter remedies, should be brought to your doctor's attention. Our lymphatic system plays a vital role in our immune health, and the lymph nodes under our arms are responsible for draining fluid and fighting off infections in the breast and arm area. If you notice any lumps or swelling in your armpit, it's essential to have them examined by a doctor. While these lumps can be caused by benign conditions like swollen lymph nodes due to an infection, they can also be a sign of something more serious, such as TNBC. When breast cancer spreads, it often first travels to the lymph nodes under the arm, so any unusual swelling or lumps in this area should be promptly evaluated. We all experience aches and pains from time to time, but persistent pain that doesn't seem to have a clear cause should always be investigated. If you're experiencing pain in your back, shoulder, or chest that doesn't resolve with normal treatment or home remedies, it's important to consult with your doctor. While this type of pain can be caused by various factors like muscle strain or arthritis, it can sometimes be an early sign of TNBC, especially if the pain is persistent and worsens over time. Don't dismiss persistent pain as simply getting older or being overworked. It's always best to rule out any serious underlying conditions. Our bodies are incredibly complex, and sometimes they send us subtle signals when something isn't quite right. Unexplained weight loss or fatigue can be indicators of various health issues, including cancer. If you're losing weight without making any conscious changes to your diet or exercise routine, or if you're experiencing persistent fatigue that interferes with your daily life, it's crucial to seek medical advice. While these symptoms can be caused by a wide range of factors like stress, thyroid disorders, or vitamin deficiencies, they can also be signs that cancer is present and affecting your body's overall health. Our skin is our largest organ, and it can provide valuable insights into our overall health. When it comes to breast cancer, certain skin changes can be red flags that require medical attention. One such change is the development of an orange peel-like texture on the breast, known as peau d'orange. This dimpling or puckering of the skin can occur when cancer cells block lymph vessels, causing fluid buildup in the breast tissue. Another skin change to watch out for is the appearance of persistent rashes or sores on the breast. While most rashes are harmless and resolve on their own, any rash that doesn't heal or worsens over time should be evaluated by a healthcare professional. Now let's address the most well-known symptom of breast cancer, a breast lump. While not all breast lumps are cancerous, it's crucial to have any new lump checked by a doctor to determine its nature. TNBC lumps can vary in size, shape, and texture, but they often feel hard and irregular, like a small hard pebble under the skin. These lumps are usually painless, although some women may experience mild discomfort or tenderness in the area. It's important to remember that breast self-exams are not a substitute for regular medical checkups, but they can help you become more familiar with your breasts and notice any changes that occur. As we discussed earlier, our lymphatic system plays a crucial role in our immune health, and the lymph nodes act as filters, trapping harmful substances and fighting off infections. When cancer cells spread from their original site, they often travel through the lymphatic system, and the lymph nodes can become enlarged or swollen as they try to fight off the cancer cells. In the case of TNBC, swelling in the lymph nodes near the breast, such as those in the armpit, collarbone area, supraclavicular lymph nodes, or near the breastbone, internal mammary lymph nodes, can be a sign that the cancer has spread. If you notice any unusual swelling or lumps in these areas, it's essential to consult with your doctor promptly. So there you have it. Those are some of the signs of TNBC that you should never ignore. Remember, early detection is key when it comes to fighting any type of cancer. If you notice any unusual changes in your breasts or overall health that don't seem normal for you, it's essential to see a healthcare professional promptly for evaluation. Early diagnosis of TNBC can improve treatment outcomes. Thank you so much for watching. If you enjoyed this video, please consider subscribing to the channel for more content like this. Don't forget to give it a thumbs up and share it with your friends who might benefit from it. We'd love to hear your thoughts, so feel free to leave a comment below. Your feedback means a lot to us.